Myself Dr. Lakshita Saini, Consultant Internal Medicine at Manipal Hospital Ghaziabad. Today we have gathered here to discuss about an ever-changing and ever-evolving topic, that is diabetes management. Why is it so important? Because diabetes has affected a large number of adult population in India, and it is one of the leading causes of a lot of comorbidities like blindness and amputations. So we need to manage it and control it well, and there has been so many studies and so many researchers that are there to help us in it. So why not we manage our disease well? So in regards to diabetes, there is one test that we all rely on so much, which is HbA1c, which gives us the average of 3 months of your blood sugars. But how reliable is your HbA1c? HbA1c is actually tells you how much your glucose is bound to your hemoglobin. So HbA1c itself gets affected with a lot of factors like your iron status, like your anemia status, your recent blood loss, your splenectomy, and so on. So we need to cater to your all the blood sugar levels, your lifestyle, your cholesterol levels also, and not just HbA1c level to label you as a diabetic, or how much on how level, with what level your diabetes are. Again, as per the latest ADA consensus, sleep characteristics of your day has been given a lot of emphasis on your progression, the risk of progression from a pre-diabetes to diabetes. Both a shorter sleep and a longer sleep, less than 6 hours and more than 9 hours, and even poor quality of sleep has been highlighted as a risk factor for the progression of pre-diabetes to diabetes. The other factor that has been given very importance in the latest ADA guidelines is vitamin D therapy. So vitamin D therapy has been advocated to prevent the progression of pre-diabetes to diabetes now. The one very important thing that has come up and has been highlighted is the fracture risk. So fracture risk should be assessed in all the older individuals, which is more than 65 years old with type 2 diabetes mellitus, and even in younger individuals who have risk factors or who are on medications like thiazolidinediones or sulfonylureas, because there is a certain small amount of risk of hypoglycemia which can increase the risk of falls. So we need to get a DEXA scan done so that we can assess the bone mineral density and we can intervene on time. The other factor that we would like you to know is that dental care examination has been emphasized a lot, and at least twice is advocated yearly, on a yearly basis, and your dental expert and your physician should be on a common page if you are undergoing any dental procedure, so that we could prevent the risk of hypoglycemias that you might have. So now, regarding other risk factors that you might be having, so if people who are with diabetes, who are obese, or we have cardiometabolic risk factors or established cardiovascular disease, they also have now a lot of number of drugs that could be helpful as a part of their mechanism in reduction of weight also. So if people who are obese and who have established cardiometabolic risk factors, they could be on GLP-1RA analogs, or they could be on SGLT2 inhibitors that you need to discuss with your physician, so that as a part of their mechanism of these drugs, we can help you reduce your weight reduction, we can help in your weight reduction also. As a part of the same memorandum, we need to ascertain your liver fibrosis test also, so that we need to discuss about the fibroscan, so that the liver elasticity has also been taken into account. And there are so many drugs and so many interventions that we could do now to prevent your fibrosis or grade 1 to grade 2 fatty liver to going into steatohepatitis or a cirrhosis level of a liver. So all in all, the message that we want to give through this video is that there have been a lot of resources, there have been a lot of development in the field of diabetes management. So you need not be afraid of this disease. You need to talk to your physician, you need to be on the same page, and this disease is absolutely manageable and controllable. Thank you.